everyone's doing well. We're here for tonight for the Path of 250 talk, otherwise known as the really short version, first day for the USMLE Step 1. My name is Tal Lee. I am Associate Clinical Professor and Chief of Allergy Immunology at the University of Louisville. But most of you folks know me as the author and editor for First Day for the USMLE Step 1. I'm also founder and Chief Education Officer for USMLE-Rx and SelfCare. We have a wonderful set of panelists. Can everybody hear me okay? All right.
Yep.
I saw something about a mic check. Okay, we have a wonderful set of panelists that will be helping answer questions tonight. So I'd like to introduce them. Sean, would you like to introduce yourself?
Hi guys, Sean Nanju here. Been with SelfCare for a little over a year, working on the RX coach side, which is our new one-on-one tutoring program. We'll talk about that, I'm sure, later on today. I look forward to answering your questions, and thank you for joining.
All right, fantastic. We also have Mark. Go ahead, Mark.
Hey guys, my name is Mark. I'm a third-year medical student at Cooper Medical School, Rowan University. I'm one of the Scholar RX coaches, and I'm happy to answer all your guys' questions.
Great, and then we finally got Paras.
Hi all, I'm Paras. I am a dermatology resident at UT Southwestern in Dallas, Texas, and I've been an RX coach for about 3/4 of a year now.
Great, so we got a number of coaches here tonight. They'll be here to help answer your questions. There's a couple. The main way to answer your questions is to go through our Q&A box. If you're using a PC or a Mac, there should be like a control panel on the right side where you should be able to answer questions. If you're using a mobile device like an iPhone, an Android device, I think it's in the top right in the menu. So feel free to fire away, and they will do their best to help answer your questions. Whatever your situation. All right, so let's I'm gonna just change something here really quick. Okay, great. So let's get going. The first word in the book, First Aid, is relax. It's actually been the word for the last 30 years. I understand things are changing. Things are, we are living in unprecedented times. But nevertheless, you will do better if you can keep your head about yourself and understand what you're dealing with and how to properly approach it. If you do that in a calm and deliberate and organized fashion, you are much more likely to succeed than using a scattershot approach. And that's what we're going to be here to talk about, and that's what our coaches are going to be here to talk about. All right, so this is our agenda. This is a longer than usual talk, unfortunately, because of all the things that have happened over the past couple of months, particularly USMLE Pastel. We'll talk about that, and then also studying with COVID-19. But normally we would also cover the basics of Step 1, defining goals, timelines for studying. How do you approach subjects, choosing prep resources, general study advice in normal times, and then of course how do you deal with COVID-19, especially if your exam got delayed. And then we'll talk a little bit about some of the new things we're doing that we're really excited about, such as RX Bricks and RX Coach at the very end. And then for everybody that can hang on to the very end, we do have a raffle and a special offer. You do have to be present to get to be a raffle winner, which is a very, very nice prize if you can hang on. All right, and then we'll open up for Q&A, which I think will be pretty robust tonight, getting everything that's going on with COVID on top of USMLE Pastel. All right, so I'm going to throw out a poll question here, and I want to hear from you folks tonight. There's a whole ton of you guys, hundreds of you folks. So, I want to know a little bit more about you guys. So I'm going to launch a poll, and you should see it pop up on your screen. And so you should go ahead and choose the answer that best describes you. And we'll leave it open for about 30 seconds to about a minute, because it takes a little while for all the results to tabulate in, especially internationally. So we'll kind of hang out here for a bit. Looks like about 20% of you folks have voted. So that's good, keep it coming. We'll keep it out for a couple more seconds. All right, 50% of you folks have voted. It's climbing quickly. We're now up to about 2/3 of you have voted. And I think a couple more seconds, and then we'll close the poll. I want to get a good sample size here. All right, I think most of you voted. I'm going to close the poll. I'm going to share the answers or the responses. And you can see, you know, over half of the folks tonight are IMGs, particularly IMGs from outside the United States or born outside the United States. But we have a fair number of U.S. Medical students who are both and Canadian who are both allopathic and osteopathic. So welcome everybody. We've got a big spread of people tonight, and I'm also suspecting that a number of people are you know, logging in internationally. So welcome any of you that are in Asia, South America, Europe, Africa. I know we always get a ton of folks, you know, for these global webinars. All right, so I'm going to hide that, and then I'm going to ask another question, and hopefully this will be a little quicker to answer because you're already at your device. So when do you plan to take the USMLE Step 1? Now, of course, with the Prometric centers being closed, you can also choose that your test has been delayed. So like to know if any of you have been impacted. So we'll see. But if you know that if you have a confirmed date, or you know that that's going to be your date in the future. All right. So again, we'll wait a good 40 seconds for folks to tabulate in. All right, most folks have voted, and I am going to close the poll, show the results. You know, small number of folks are going to be using in 18 months. 6% have been delayed, especially at least with what's going on in North America, but Prometric centers around the world generally have been closed. So, and then a chunk of you will be taking it later this summer. That's a little bit higher proportion, so I suspect some of you might have already rescheduled already. We'll find out. And then a big chunk of you folks are not going to be taking until after 2021. I thought I had a question about whether you were taking it after in 2022 or not, but unfortunately it doesn't look like the poll was set up that way. But we'll talk a little bit about that and the timing of the exam a little bit later. All right, I'm going to minimize that poll, get back to the presentation. So now I'm going to just cover the basics of the exam. So as many of you already know, this is a one-day exam, 8 hours to be precise. There's 208 questions per exam in 7 one-hour blocks, so that makes it 40 questions per block, and you have 45 minutes of break time. And since you have 44 questions per block, that works out to about 90 seconds per question. All right, and you know, the way it's set up, you know, you got an intro block here, and we'll talk about that in just a bit. And then you've got your 7 exam blocks somewhere in the middle. You will be taking a little break, you know, for lunch or snacks or bathroom breaks. Could be one, could be a couple. And then afterward, there's usually a survey as well too. So I'll just put that there, but it looks way different than anything else, so it won't sneak up on you. You are allocated 15 minutes to do the orientation block. However, you should know that the orientation block is the same block, the same information you can get if you download, you know, the program from USMLE.org, the sample test. It has the same orientation block. So honestly, what you should just do is you open this up. You just use there is an element in there where you can check your audio just to make for your headphones for the handful of multimedia examples. So if you just do that, just spend 1 minute in there just to check your audio and exit the brick. You actually then will get 14 or close to 15 minutes of extra break time. So at a minimum, you should start off with about 60 minutes of break time. The other thing to know is that if you finish any of these blocks early, for example, you get out of this block saying 50 minutes or whatever, the time that you have left over also goes to your break time because you have a total of 9 hours in that day, you know. So so keep that in mind. All right. So what are the types of questions you see on the USMLE? So all of them are going to be single best answer. So that should be straightforward. A handful of them have multimedia, as I mentioned. Most of them are going to be case vignette or scenario based. You know, 35-year-old male presents to the emergency room, that type of stuff. And the majority, or I'd say close to half, will have multi-step reasoning. And what I mean by multi-step reasoning is that there's an integration of multiple concepts that are related together. So it could start off with a, something about the pathology, but then the question, veers into treatment or drug mechanism for something that's tied to the clinical presentation. So here's an example of a multi-step question. A 32-year-old Caucasian woman presents with a 5-day history of occasional double vision and bilateral ptosis. And then it goes on to ask, what is the most appropriate diagnostic test? And so you immediately realize right away, this is not a single step question, because otherwise it should just ask you what's the diagnosis, right? That's the most appropriate thing to ask from that type of thing. So step one is what is the diagnosis, what's going on here? And then it's really asking you what's the diagnostic test. So once you have a diagnosis in mind, then what is the right diagnostic test? So in this case, with this particular woman, Caucasian, fairly rapid onset of these findings, including the bilateral ptosis that's symmetrical. You're probably going to be thinking something like myasthenia gravis. You could argue for something like multiple sclerosis, but they tend to have unilateral findings. And so in this particular case, if you're thinking myasthenia gravis, the classic way to make the diagnosis is with something like idrothonium, which is a short-acting acetylcholinesterase inhibitor, classically known as the tensilon test. That's still potentially used in some places internationally. In the United States, it's largely been replaced by anti-cholinesterase antibody assays. So that's an example of a two-step question or a multi-step question that you might ask. Occasionally they'll have three-step questions or problem-solving questions where you're given data and then you actually have to do some calculation, like you're calculating sensitivity, specificity, that type of stuff. They're not all straightforward. And so, one of the takeaways is being able to integrate the multiple concepts when you're studying. So when you're trying to break down a question, like RX coaches would be doing with you, they're going to try to take you through the multiple steps that you have to do to go through the logic and break down and then ultimately solve that question. All right. So what does the interface look like? The interface is pretty straightforward. You can see here is your question with what's called the stem and lead-in. Lead-in is actually the actual question, which itself was just asking about the diagnosis. You've got 4 to 5 choices most of the time. Sometimes you'll have 6 or 7, and then about 15 to 20% of the time you'll have some diagnostic image or some sort of path or visual information and so forth. And then, of course, as you see, you got your navigation, lab values, and so forth on the top, and then some more navigation as well too. The all-important timers at the bottom, you'll have the timer for the block as well as the timer remain for the day. The other thing to note is that you can lock your exam if you need to go use the restroom or take a break, but the timer will continue to run, okay? And then when you are done, you can exit the block even if you have time remaining. And then, like I said, that time will continue to remain in your day timer. But and the other thing to remember is that you can navigate and change any of the answers until you exit the block. Once you exit the block, you cannot go back and change any of your answers. All right, let's talk about scoring and passing rates. Passing is currently 194. As far as we know, it'll stay that way at least for the short term. They usually announce any scoring changes in the fall time well ahead. So that's where it should be. The mean has been bouncing around 229, 230, and the standard deviation has been very stable at about 20 points. For US and Canadian medical student, allopathic medical students, the pass rate is pretty high. Essentially everybody passes, and essentially the same thing for the osteopathic students, as I mentioned. But for IMGs, including US and internationally born IMGs, the pass rate in the first try is in the high 80s, high 70, low 80s typically on the first pass, but usually within 3 tries, IMGs will have a pass rate greater than 90%, at least in our surveys and from what we know from that experience. The USMLE does provide percentiles. You can get that from USMLE.org. We took the data there and we actually graphed it out. And you can see there's an S curve and it flattens out pretty much at around 260, 270. So if you're scoring at 270, you're essentially around the 99th percentile. And you can see here that the minimal passing score is around the 5th percentile, and your 50th percentile is like roughly around 230 right here. And then again, the proverbial 250 is going to put you right around 85th percentile. So 1 standard deviation above the mean. All right. So one of the key things that you need to think about ahead of time is defining your goals. We try to keep it simple in first aid. We talk about just passing the exam, beating the exam, so scoring above 230, and acing the exam. So again, that 250 or above. Obviously, one of the factors driving your goal setting, is what you might be interested down the road. If you believe that you are realistically interested in one of these specialties that are very competitive, so as you can see by the mnemonic, radiology, radiation oncology, the surgical subspecialties, urology, so the surgical O's and U's, and then aesthetic, which is our stand-in for plastics and dermatology, obviously what Paras went into. Then you might want to aim for a higher score, like around 250, since they often use the USMLE Step 1 as the screening tool. All right, so that being said, we're all aware that there will be some upcoming changes, but it's not happening anytime soon. So, the USMLE is slated to go pass-fail sometime in 2022. But we don't know when. We don't know if it's early or later, and who knows? Given the COVID pandemic situation, we don't really know. We know that the other exams, Step 2CK, Step 3, will remain numeric with pass-fail. We also know that sometime in 2021, the maximum attempts for each step will be reduced from 6 to 4. That may have more of an impact on IMGs than that will on North American students, since most schools in North America typically limit to 3 tries, the majority. And then also something that might impact IMGs is that Step 1 is required for Step 2 CS. In the past, you could take Step 2 CS, Step 2 CK, and Step 1 in any order you wanted for your ECFMG application, and that's slated to take effect sometime in March 2021. Again, or later. As you can see, the USMLE has given themselves room to delay any of these changes for whatever reason, including what's going on right now with the pandemic. I think the critical thing, obviously, is what people are wondering is that what will that, what that impact me, either as an IMG or as a U.S. medical student. And I'm happy to report that for most of you folks, it shouldn't really have that much of an implication in terms of you having to second guess everything. On my last webinar, about 5% of you said that you might be taking the USMLE after 2022. So you may need to think about it, but for the most part, even if you're taking that exam in 2022, because it can the switcher can be delayed, we're still advising that you assume that the exam will be a scored numeric exam, just in case, and prepare, accordingly. Obviously, you'll also want to prepare, well for the USMLE Step 2 CK, because by 2022, a lot of the competitive residency programs will be using that as a screening tool as well too. I'm sure there'll be some questions about this, and we'll try to handle it very thematically. But I'm sure our RX coaches are spelling that out for you right now in the Q&A. All right, a couple of other things I want to show is that, yeah, there is a correlation in the median scores of applicants who who score in where they match. And as you can see here, those that are matching in competitive specialties, like Paras and my brother who did otolaryngology, they tend to have higher scores, and everybody else is around the median, more or less. There is a silver lining for those who are North American medical students and are interested in a primary care specialty or one of the big ones, and it's shown by this graph here. And what you'll see here is this is the median probability matching by preferred specialty by using score. This is a very old graph, so the data the data itself is outdated. However, the general curves, I think, are still applicable, so that's what I'm going to just focus on. What you'll notice is that even for U.S. medical students who failed, they still have a pretty high probability of getting into their specialty, as long as it's something like internal medicine, pediatrics, general surgery, emergency medicine, one of the bigger specialty, as opposed to something like dermatology or otolaryngology. So that, which is represented by this light blue line, which is obviously you'll notice that it has more of a steep drop off. For IMGs, again, this curve, probably is not applicable anymore, but the slope is still applicable. There's a flat curve. You'll notice that, even with high scores, it's not a slam dunk. But on the other end, even if you have just an average score, IMGs still have a fair shot. But you certainly are going to have to think about, other alternatives or backup applications like, internal medicine backing up radiology, stuff like that. All right, so I'm going to ask another question right now, and just to make sure you guys are awake. But I do want to ask and see what type of goals you're setting for yourself. Do you want to just pass comfortably? You want to ace the exam? And think about it, and then just keep in mind there is no wrong answer. All right, we're gonna keep it open for a couple more seconds. Again, we're tabulating all the responses, particularly that are coming in internationally. And while the answers are coming in, I did get a question from our coaches that many of you guys are having questions about the maximum attempts. It's cumulative as far as I understand. It's not per year. You don't get a reset per year. So it would be 4 cumulative. That's the way I understand it. If anybody knows anything differently, just do let me know. All right, I'm going to close the poll and share the results here. And what you see is that the majority want to ace the exam, and that is a complete, fair, and valid goal, especially if you want to keep the doors open for any of those competitive specialties, or if you're an IMG and you just need to score above average. All right, let me hide the results and get back to the presentation. All right, so let's talk about the timeline for studying. Again, we like to keep things simple. We have the just pass schedule, which is a couple of months, and it's first aid, crammable subjects, a couple of question banks, and you may be good to go. And that's perfectly fine if you're just need to comfortably pass. Maybe just do above average. You're a pretty good test taker. You're just going to do something like family medicine, and you don't really need to sweat it. For other folks, if you're really needing that 250, if you have had challenges with multiple choice exams in the past, standardized exams, if you're coming from a place that maybe is more middle of the road, and you need to do something to distinguish yourself, you might think about a more intense schedule. So that could be more time than a couple of months, and you're going to be doing a much more broader review. much more broader prep, and you're going to be doing a lot of intense, self-testing with multiple question banks, 2, 3, maybe even more question banks. All right, so let's talk about study strategies, and there's going to be a couple of things here that will influence that. Part of it is your learning preferences and your learning habits. We are assuming that you do have good learning habits, but we'll talk about some things that you might want to make some changes in your learning habits if you're not doing already a little bit later. You need to know about the structure and characteristics of the subject. So for example, Pharm and Micro often can be approached with flashcards or charts and tables because the information is fairly well structured, whereas something like Physiology is about relationships and cause and effect diagrams and whatnot, and and they're using mind maps or diagramming things out might be a more useful way of learning. So think about the pedagogical needs of the subject. Then you need to think about the strengths and weaknesses of your curriculum. So if Micro was not well taught at your institution, you may have to spend more time and resources on external prep for that subject area. And then also time to any subject system. So if you're doing neuroanatomy, you might do 1 or 2 days, and so that you're going to be sticking to the basics, like high yield review, lots of questions, some flashcards, that type of stuff. But if you're spending like weeks, if not months, on something like multi-systems pathology or whatnot, then you'll have opportunity to do other things in addition to the core, to some of the core techniques. All right, so I'm going to go through this pretty quickly because it's on my website, firstaidteam.com, and there are plenty of recorded. We have a recorded version there that goes through this, but I'm just going to hit the highlights of what's generally high yield in each of the major disciplines, and of course they can be extrapolated to organ systems. So and you'll see a couple of themes emerge as I go through this. So one of the major themes is that while USMLE Step 1 is billed as a basic science exam, it really actually has a lot of clinical relevance. And so, as I mentioned, most of the questions are case-based. They're going to ask about anatomy. They often ask in the context of a specific condition, some sort of injury, landmarks for procedures, that type of stuff. So if you present in the emergency room, or if you see a patient presents in the emergency room, and on X-ray you see that they have a spiral fracture of the humerus, the question may be about what type of sensory or motor loss they have in their extremities, based on a specific nerve that runs through the humeral groove. So things like that. Neuroanatomy, embryo are discrete, but they tend to be high yield because of the richness of the clinical cases that can be put into there. Cross-sectional anatomy, is going to show up, but as clinical imaging, so CTs, MRIs, ultrasound, X-rays, and then also as microanatomy with EMs and histo and photomicrographs. Biochemistry is one of those crammable subjects, and that has some structured, repetitive concepts, and we'll talk about how to handle the crammable subjects a little later. And again, you're going to see that there's a predilection, there's a preference by the USMLE item writers to go for biochem that has some sort of clinical relevance. It's rare that they're going to be pulling something that has absolutely no connection to human disease. So think about the pathobiochemistry of the molecular, cellular biology and genetics and all the stuff that you're studying. On the clinical and translational and basic benchtop investigation side, you know all the laboratory techniques that show up, things like ELISAs, RT-PCR, how is it done, what does it do, what questions does it answer? And if you were given some data like, flow cytometry, how would you be able to interpret it? Microbiology, also crammable. The key thing here is to keep in mind that it's not all bacteriology. So, so just be aware that there's other high yield stuff in other areas. In terms of what they tend to focus on, this is fairly well structured. So think about, how it's diagnosed, by its distinguished characteristics, where it tends to go, how it gets there, vectors, reservoir, and how it's treated. On the immunology side, again, think about the clinical relevance. Think about the, how the immune response works in, normal and abnormal situations, how it works, how it can be manipulated by vaccines, and what happens with immunodeficiencies, which will show up on the exam more frequently than you'll probably ever see, in your clinical life. And with pathology, this is a big topic, and obviously something you want to focus on if you're wanting to do, at least above average. The good news is that, with most of the clinical presentations, especially the more uncommon ones, they tend to stick with the basic presentation or the basic variations. Now remember, a lot of these things can present with some similar signs and symptoms, and only sometimes in retrospect does it become obvious. For common conditions like diabetes, asthma, and so forth, you'll often see more variation. A favorite example is asthma presentation in children, where sometimes the only sign that you'll get or symptom you'll get is a presentation, some coughing, and it could be allergies, it could be a viral thing or whatever, but it could be actually cough-bearing asthma. So you got to keep that in the back of your head. The boards is should not be trying to deliberately trick you. Now some question banks do that, but that's actually not what the board does. So if they present something with age, gender, ethnicity, and it goes along with the clinical presentation, it should be okay. I'm not saying that that's the way it is all the time, but it should be okay. So keep in mind, if they've been traveling, if they've been working in the Rose Garden, if they've been eating fava beans and stuff like that. Now, some of these things are so classic that they're buzzy. So a lot of times they don't use that, but otherwise look for those clues that often that can show up, and they're not meant to be a red herring. They're not meant to throw you off. That being said, they won't be using buzzwords or trigger words. They won't be using eponyms and stuff like that. So need to know what these things look like. You need to know what a Janeway lesion is, Osler nodes and stuff like that, how it actually presents, and how they will clinically describe it. With pathology, you will see images and also some multimedia as well too. But the good news is, I would say the majority of the time you can answer it from the history alone. And we've often found, is that you just cover up the image and don't get distracted by it, because you often don't have the context. You can solve it, and then you can use the photomicrograph or whatever as reinforcement, or the multimedia as reinforcement. All right. Pharmacology is also crammable. Oops, where's my pen here? It's also crammable because, again, there's often structured information that asks about the same things all the time, like mechanism of action, clinical uses, adverse events, drug-drug interactions. If you just need to pass, of course, you need to focus on the low-hanging fruit, like the prototypical drugs and the major variants. If you need to do better, obviously you need to deal with the minor variants as well. But they're never going to ask you about trade names, and on the step one, they're not going to be asking you about dosages. These are the major areas, like the big low-hanging fruit areas, and they're generally well covered in first aid. Physiology, as I mentioned, concept oriented, because you're often thinking about cause and effect, and what inhibits what pathways and so forth. So think about using diagrams and mapping things out, or studying off illustrations or algorithms, to understand those relationships. And again, the physiology is often inextricably integrated with the pathology. Psychiatry, all right, it's tends to be a mix of psychology, sociology, psychopharmacology, and there's a tendency for us to focus on mood disorders and whatnot, but there's a whole host of other high yield areas, and again, those are covered in first aid. All right, public health includes biostats, epi, ethics, and those are the traditional subject areas. You're going to be seeing more and more healthcare delivery, patient safety, patient communication is going to get bigger, especially for those of you who will be taking the step 1, after May, and there are going to be more patient-doctor communications as well. Biostats, epi, they're always classic, especially for problem solving. I should also mention on the pharmacology side, while there's certainly going to be mechanism, drugs, and that type of stuff, our understanding is that also after the beginning of May or sometime in May, we're not 100% sure now with all this COVID stuff. The USMLE is contemplating reducing the number of treatment questions, so drug questions. Some of those we think are going to be moved to the step 2, but we're going to wait and see with what the USMLE actually does, especially in these interesting times. All right, so that was a quick whirlwind tour through what's high yield, low yield, and all the major subject areas. And again, all that's on my blog, including these slides. So really just keep the big picture in mind about making sure that what you're studying is clinically relevant and integrated with other concepts that you can easily integrate them. All right, now we're going to briefly talk about review resources. All right, and so there's a number of things you can use. There's text reviews like first aid, test banks like RX, obviously, self-test reviews, and so case-based reviews, some books out there, review courses, tons of digital stuff out there, flashcards, video, mobile apps, plenty of things out there to help you prepare. So how do you pick and choose among all these resources? There's a couple of things to keep in mind. In the back of first aid for the USMLE Step 1, we provide detailed resource reviews, or actually just the grades in the book. If you want the full reviews, you need to go to our blog at firstaidteam.com. I'll show you where that is, where we actually have the actual text. There just wasn't enough space to publish the text reviews or the written reviews, sorry, in the book. Once you decide what you're going to use, try to integrate that resource early into your studies. So if you're currently still in med school, try to do it as part of your coursework. Oops, sorry. If you have graduated, if you're an IMG preparing, start using it right away, and as part of a long-term deliberate preparation plan. Try not to overbuy. We can sometimes stress ourselves out by buying more things that we can possibly use. And then just realize, particularly for things like books and whatnot, that some books in a series are better than others for the subject that they're trying to teach. So just keep that in mind. All right, so I have another question, which is, what resources do you plan to use? And this will take a little longer because this could be none of the above or all of the above. So think about it and pick the ones that you are most likely to use for preparation. All right, I see that about 30 guys have answered. About half have answered. Excuse me. I'll wait a couple more seconds. All right, around 3/4 you've answered. I think that's plenty. So let me close the poll and share the results here. And what we see here is almost everybody's using a question bank. Most people are using books. Most people are using videos of some sort. And quite a few of you guys are using flashcards and mobile apps. All right, so that's a good spread. All these are applicable resources. Okay, so let me jump into some study tips here. So there's some, so there's some basic time-honored, advice that students and IMGs, have found useful. One is when you obviously plan ahead early, and so it should give you the ability to establish a study schedule that you should be able to stick with. Now you need to do certain things like don't overschedule yourself. Make sure you got time for breaks. Even during dedicated study time or full-time studying, I would advocate that you take at least a day off a week if you can, or just keep it super light on that day, like a Sunday or whatever, for exercise and breaks, and that you save a week or two, just for catch up or just self-testing at the very end. And if you do things like that, you should be able to stick with it and shouldn't really have to revamp your study schedule. Other things to think about, as I mentioned, is always think about how you can integrate whatever you learn. So you learn, if you're reviewing some pharmacology today, think about how you can integrate it with the pathology that you learned about a month or two ago, or think about how that integrates with certain molecular or genetic pathways and whatnot, right? So just think about how these things can interact with each other, because that's how they often test you on the boards. Especially with the multi-step questions. We always hope that we don't cram, but at the end you're going to be doing a little cramming, which will always be towards the end. Now, a lot of times you want to, if you can, you want to kind of align what you're studying with your school's curriculum if you can, if you're still in medical school. But if you're in your dedicated study period, things like metabolic pathways, micropharm, some of those subject areas might, you can experiment and could work a little more towards the end, where while it's not great, it's okay to cram a little bit, especially if it's just a couple days or a couple weeks before the exam. You always want to focus on things that you've learned before. You already have a good mental framework, hopefully, about those concepts, and that's easy to resurrect as opposed to something that you've never learned before, even if it's been deemed high yield. Obviously you'll get to it, but relearn what you learned first. At the end of the day, as I mentioned, you got to be very deliberate. You got to take the long view here. We do have a checklist that's in the front of first aid, right after all the acknowledgments and stuff, and all the thank yous. But right at the beginning of our study guide, that'll kind of help you, organize your studying in the weeks and months ahead of the exam. Do look at that, earlier rather than later. All right, a couple of things about studying during COVID-19, and again, this is thanks to the RX coach. We've already been talking to a number of students that are having to deal with this, and so so our coaches are talking about in addition to what we just talked about, and just to reinforce, you got to be sure you take care of yourself. So self-care. There's a lot of anxiety. There's a lot of uncertainty. That's certainly not helpful. You're already stressed out as it is. So first of all, keep yourself mentally level. And if you're having any problems, do seek help. The second thing is, especially if your exam got delayed because of the prometric closures, don't just take a vacation. You want to rejigger your study schedule to take advantage of that extra time. All right, and make sure you've got some structured support. If you don't have structured support either at your school or because you're out there somewhere, again, reach out to us. We can help you with structure and coaching through this. All right, as I mentioned, continue to do some maintenance, even if you think you're already especially if you think you're at your peak. The key thing is not to burn out. Key thing is to kind of keep that high energy going. And so you want to continue to work through your Qbanks, maybe get some additional Qbanks. There are a number of things that are out there, that are discounted or even free these days. continue to test, retest, look for your weaker areas that you can focus on, continue to work on your test taking skills, and continue to use some of the assessment exams, whether from the NBME or the USMLE-Rx self-assessment exams or the UWorld self-assessment exam, to keep keep benchmarking how you're doing and to continue to at least maintain, if not improve. So that's at least maintenance. But that being said, hopefully you can even try to get on offense. So especially if you think you've got some room to improve, you can continue to try to focus on areas of weakness. Again, doing reviews and again practice self-test and more self-testing. All right, so that's just a little bit of advice from our RX coach team. All right, so let's talk about computer-based testing. All of us should be pretty familiar with computer-based tests. It's pretty much how it's done these days. The CBT tutorial, as I mentioned, comes with the package you download from USMLE.org. There are keyboard shortcuts, though most people stick with mice. And of course, you want to computer test yourself. In addition to any other resources out there. And the key thing is you want to be doing Q&A all the way through from beginning to end. And there's a lot of evidence for that. The bottom line is, and this was a study that was done several years ago, the bottom line is if you do retrieval practice, which is basically self-testing, you do better on exams versus any other method of studying. Even for simple questions, and even for more complex questions like inference questions, you still will do better. All right, so what about all those digital testing options? What's out there? Of course, there is the USMLE sample tests, roughly 120 items. They update them on a regular basis, but there's still some outdated stuff on there. So I think it's mostly helpful for format familiarity. You do have the NBME CBSSA. That's the comprehensive basic science self-assessment. It's good for benchmarking. They're about 40 to 60 bucks a piece. A couple of them now also have explanations as well too. So they can be spaced out, every couple of weeks or whatever when you're dedicated to benchmark how you're doing. In addition to using self-assessments from RX and UWorld and other places as well. And then of course there are the Qbanks like RX and UWorld and so forth. And these are good for practice, study, simulation. We can also predict your score as well too, within 20 points, if you do enough questions on RX. All right, so what's the research for Qbanks and other test resources, and what works and what doesn't work? So no surprise, Qbanks work, and they are more effective than flashcards, mostly because they're simulating the real thing, whereas flashcards aren't obviously USMLE style questions. How many Qbank questions do you have to do to get a step on a point on the step one? It depends on what study you look at, but roughly it's anywhere between 300 and 450 questions. And how many questions do you need to do ultimately? The true answer is we don't know, but in this study out of University of Michigan, students who did more than 3,200 questions did better. That was the top tier. They didn't ask if anybody did more than 5,000 questions, for example. But it seems like there is a dose response. The more questions you do, the better you do. Also, does it make sense to repeat the questions? And the answer appears to be no. In the Michigan study, students who did unique questions, of those three, if they were unique, they did the best with that. If you repeated the multiple choice question, so you kept going to the same question bank over and over again, you did not get any additional benefit. The last thing that's been shown in the literature, the research out there, is that going through first aid actually helps. Not a surprise, we all know most of you are using first aid one way or the other. And it turns out, at least in the Michigan study, students who did 3 passes or more through first aid did better than students who did not. So I hope that helps in terms of what's the research evidence for that? All right, so some test day advice here. Couple of things. Obviously, you're going to be very excited that day, so you might want to back off on the stimulants. You're going to be, well, when the test center opens again, you're going to be in an office building type situation that's often cold or occasionally can be warm depending on the side of the building you're on, if there's direct light coming in. So have layered clothing you can adjust so to keep yourself comfortable. On the USMLE, some of the questions can be occasionally long. If you run into those things, now in Rx Coach we have a general way of doing it, but if you have your own way, and you're still running into a big honking question, do try to look at the lead-in first. The lead-in is the question, like what's the most likely diagnosis? Then visualize the options, then go back and work your way through the STEM. But again, the Rx Coach can tell you a little bit more about techniques for managing short and long questions. In terms of managing the clock, as I mentioned, you've got 90 seconds per question. I generally recommend that you try to commit to an answer within 70 to 75 seconds. Even if you have 90 seconds. The idea is that if you do that, you'll have some time to go back and work on some of the solvable questions, right? You'll have 8 to 10 minutes or something like that, depending on how much time you save. Now, when you do that, obviously mark the questions you might want to go back. Don't mark too many questions because you won't be able to go back and get them all. Mark the ones that you think are solvable, the ones that are not. Think about, you got to work like an ER doc. Think about the ones you can save, and the ones that are lost cause. Just go buy them. I've mentioned that obviously you'll want to have time for breaks and so forth. You have to kind of figure out your rhythm. Some people do 2 blocks a break, 2 blocks a break, that type of stuff. So some people will go 3 blocks, then take a light lunch, then 2 blocks, light break, whatever. If you want to, you can go to USRX and do a full day simulation that can give you a sense of where you lose your energy or whatever during the day, or where you get hungry, so you can make a decision about when you want to do it. On the exam, there will be, as I mentioned, certain questions that you're just not going to be able to get, because there's a spread of easy to very hard questions, very easy to very hard questions on the boards often. So have a favorite choice in mind, especially if you can't, rule out any distractors. We joked in our study group about having the C reflex. Didn't know what's going on, hit the C reflex and go on. As I mentioned, you want to save, you don't want to waste any time on questions that aren't solvable. And also do keep in mind that occasionally the boards has experimental questions that won't count. And so, hope that one of those hard questions is an experimental question.